I'm going to create a test patient and document as if I were doing a total knee case. The first page I had protected health information covered up. That was our daily patient list. And now I am in this screen where we enter patient demographic data to enter them into our system. This information is usually entered by operational staff. They receive a list of patients from the surgery center and they do this data entry for us. We usually only have to go through this screen if there is an add-on case. This process is automated at most facilities because there's integration between the facilities EMR and Graphium. However, we do not have that integration at Pira Surgery Center. Now that the patient information has been entered, I'm going to add a short form, which is the document set that we use when we're charting on patients. It includes everything from this first page here, which is where we take a picture of the demo sheet, just taking a picture of a blank piece of paper here for reference. The next page shows a place to take more photographs. This is where we would take a picture of insurance cards, driver's license, other information. So there. This is the pre-op assessment form, and I'm going to click through in the way that we would normally do the pre-op assessment. Information that we enter on this page will carry over to our intraoperative documentation and also auto-populates onto our charge tickets. This is the feature I told you about where we can enter the height and weight, and it will automatically convert it into metric and calculate the BMI for us. Next, I'm going to apply the normal pre-op assessment template. So it's there on the top of the list. And when we click that, it automatically defaults to everything normal and allows us to go in and chart by exception. In these yellow fields, we have a couple of options for how we enter data. I told you that I type some, and this is an example of typing. We're also able to write, so I'm going to move this keyboard and write on the screen and show you how that works. And I tested the dictation feature, and it does work. Tonsillectomy. The fields that are white, like the lab field, you write in pencil, so that's the only way to enter data in those fields. Design the flow of the pre-op assessment form to be by body system with airway at the top. And again, the boxes to the right are where I told you we're able to type in extra information and notations so that there's more detail beyond just the check boxes. We really like this flow because it allows us to be detailed where we need to be, but also allows you to glance very quickly at the pre-op assessment form and get a clear picture of the patient's clinical history. I know the goal is to have this information come in automatically based on the H&P from the surgeon's office, but my concern is the number of surgeons we have that don't have a PDF that they're sending over and how that information will get entered. This is the intraoperative record for the patient, and I'm going to enter the surgeon's name here, have a set list for the facility, and then apply a template. These are the templates I told you I designed. So there's general endotracheal tube, LMA, nasal cannula, some pediatric cases, etc. And I went ahead and applied the general with an endotracheal tube template. There's a spot at the top of the record to chart pre-medications, which is really nice because once I go over and assume care of the patient and start documenting, I can stay on this screen the entire time. I don't have to flip back and forth between the pages, which I really like. It's very helpful from a workflow standpoint to be able to stay in one record and on one page. This top box is the spot for us to document airway management, positioning. To the right, we have the OR, start and stop times, signatures, and information for after the case. So it's kind of tucked to the right and out of the way. The care model tab defaults to medical direction, but we can change it manually when we do our own cases. And we've got antibiotics, tourniquet, a spot for notes down here. This is, if we do have any narrative in a case, this is where we usually write it. I'll point out that the fields in red are required. If those are not completed, it will not complete your charts. And I think those are the critical elements for billing, and it's a good way to draw attention and make sure that those fields are being completed. This is how we document medication administration. There's a full list here, so if the medication is not on the template, it's very easy to go in and add to your list. We've got IV fluids and gases down here. On our pediatric templates, it shows nitrous because we usually do inhalation inductions. But again, each template is set with the medications that we most often use for that type of anesthesia. All of these things down here are critical elements for documentation for us as anesthesia providers. I'm writing it all in. I noticed last night there was a drop-down menu for heart rhythm, but that changes during the case. So is that something that can be changed as the case goes on, sinus rhythm to sinus tach or AFib? Vent settings are documented at the bottom of the record every 15 minutes. At the end of the case, there's a column to document the total amount of medication given. There's also a column to document waste. Our facility, we waste on a different record outside of Graphium. That's for facility records. We don't need to track that as an anesthesia group, but the option to document waste is there on the right next to the total dose administered. So I'm updating end times now and going to show you how we document going to PACU. So this is our PACU arrival time. We've got a spot here to document extubation, if the patient was transported with an oral airway, if they're receiving supplemental O2, and arrival vital signs. Now I'm documenting the end of the anesthesia time for billing purposes, and then the box below that is the PACU reassessment prior to discharge. This is the post-anesthesia eval, and this is the last part of the documentation we complete before. The intra-op record is complete now, and I'm swiping over to show you the billing sheet, the charge ticket. It has automatically pulled all of this data over from our documentation, and we do not enter anything on the sheet. Again, it's all automatically populated. There are some extra information pages and documentation pages that can be added from this list up here. So I'm going to add a regional page to show a peripheral nerve block. You can add a photograph of the ultrasound here for billing documentation. I started to sign this record to complete it. I did not sign the pre-op assessment, but decided to wait. I'm going to go out and show you what it looks like on our screen. So this is green when the record's complete. So you're able to look at that record from that previous menu and see that something's not done, which prompts you to go back in and sign the case. It's really helpful at the end of the day. I always go back and look at my recent encounters and make sure everything is green before I leave for the day. That just lets me know that everything the billing company needs to get charges submitted is complete on the record. Now, when I go back out to that previous screen, you can see it turns green, and that's just a visual indicator to me as a provider that my documentation is complete. I'm going to also add an extra information page so you can see how that's formatted. This is what we use if a provider relieves someone, so that there's a third person who needs to be included on the anesthesia record and time is being billed under their NPI. It also gives us a place to document things like controlled hypotension, additional procedures, unusual positions on the left, and then on the right there's some procedures, so arterial line placement, neuraxial anesthesia, etc. Information that we put on the extra information page also gets pulled over to the charge ticket, so you can see here it is billing for controlled hypotension.